Welcome to Barbell's Business and Boobs, where we discuss navigating everyday life as lifters, business owners, and being a woman in a male-dominated industry. Today, I am so excited. I always love when we have male guests come on. Mike Warner, who is a coach with Marek Health, was kind enough to come on and talk to us about TRT, specifically in women. So thank you so much, Mike. Welcome.
Thank you so much for having me, Brittany. It's an honor to be here.
So, I want to first start out with how hard of a topic this is to talk about because in men, it's pretty straight up. Men have been taking testosterone. It's a male sex hormone. So, talking about it from the woman's side is always a little bit daunting. I know both you and I were a little bit nervous, especially because there's internet experts, as you would say. So it's nice to have someone that has been working in the field. So give me a little bit on your background. You're a competitive bodybuilder. Have you always been a coach?
I have been for over 10 years now. So I got my undergrad from San Jose State, and from there, I actually went to EMT school at the same time, thought I wanted to kind of go down the clinical path and be like a first responder. After that, I realized that I didn't want to go down that path after working on an ambulance for a while. Then I really transitioned into one-on-one personal training. Before, being an online coach was cool or the thing to do. I was in the trenches working odd hours and doing that one-on-one personal training. And, after that, I continued to go through different courses and, eventually got up to here. Obviously, I'm fast forwarding a lot, but I've been a coach for over 10 years now. Started in person and then now moved to online coaching in the sort of health wellness space overall. And it's really coaching beyond macros. It's that full 360-degree view where we're looking at labs or understanding where different pain points are, understanding context overall, lifestyle over, the course of somebody's 10 years plus, what brought them to where they are, and just kind of gathering as much insight as possible versus, okay, here's your height and weight, and here's some basic macros for you. Now go and train X amount of times per week. It's a little bit beyond that now, but yeah, that's a brief sort of summary on my history, but I work at Marek Health as one of the coaches there.
How did you find Marek Health? I feel like Marek Health was one of two of the first HRT clinics that I even heard about. I was living in the East Coast when I first heard about that in Transcend. Those were the first two that kind of got popular. So you were in California. How did you get introduced to the company?
Yeah, that's a great question. So I am, as you kind of mentioned earlier, I am a competitive bodybuilder, have been doing that for several years now. And as a natural, I think, competitor would be inclined to find online other communities and things that, where people are discussing, bodybuilding overall. And so I found myself watching Fouad Abiad's Real Bodybuilding podcast, where he actually mentioned Marek Health quite a few times. And at this point in time, I was living in San Diego, coaching full-time on my own, just online, not in person anymore. And I thought, you know what, that's really cool. I had already gone through Sam Miller Science course, and already going through lab work, already understanding sort of full context into somebody's lifestyle, then also helping them manage through whatever sort of pain points they have to get them to their goals. And I realized Marek Health seems pretty similar to what I'm already kind of doing here. So I was watching the podcast one night and I decided, hey, I'm just going to shoot my shot and send off an email and see what happens from there. And sure enough, they responded back pretty soon after. And that was just over 2 years ago now. So thanks Fouad and Real Bodybuilding Podcast for introducing me to Marek.
Yeah, I love that podcast too. And because of that podcast and social media, one of the pros is no one really talked about HRT until 2020, I feel. Would you say that's accurate?
Yeah, I definitely think there was a huge wave of just being popular to talk about, or maybe okay to talk about. I think there's still quite a stigma about it, but it turned from being not cool and being hush hush to, we're just going to talk about it because we know that people do it and let's just put it out there. And so it kind of became this like, yeah, maybe around that 2020 marker, so where people just it started becoming cool to talk about whether
Mm-hmm.
there are other anabolics or just other, even TRT, just HRT in general. It's not around that time.
Yeah, I'm thankful for it because I can remember arguing basically with my doctor, my regular practitioner. I wanted to get blood labs, see if everything was in check. And she's like, you don't need to. You're too young. And that's when I realized you really had to be on it for your own health and be educated yourself because, and I'm sure I'm speaking for a lot of women, but a lot of us go on hormonal birth control at a young age. We start taking a synthetic hormone, which is going to alter everything. Again, there's pros and cons to that. That could be a whole nother episode. But I struggled from a young age with acne. And I feel like the answer was, okay, here you go. Here's birth control. So years later, once I learned more and became a competitive athlete and wanted to be as strong as I could, optimize my body composition, I decided to come off of birth control because I realized it was really just a band aid for certain other symptoms I was experiencing. So, and I'll be completely candid, we'll talk about this later in the podcast. I did not want to go on any type of HRT just because I felt, I was 31 years old. I thought I can do this naturally. And I found out I couldn't. No matter what I was doing, my blood levels weren't changing. But we can get into that as that goes on because I'm kind of the person that takes the approach. I don't want to do anything unless I absolutely have to, but obviously I want to be the best athlete and optimize myself as much as I can while being healthy
Yeah.
overall. So, first, I just kind of want to dive in. There's HRT and TRT. Those get thrown together. So HRT is hormone replacement therapy. There's a whole umbrella under there. But today I want to focus on TRT, testosterone replacement therapy. And as I said earlier, it's a male sex hormone. So how does HRT and TRT differentiate? And how does Marek and you kind of look at everything as a whole?
Yeah, that's a great question. And even if I could just touch on one thing that you mentioned, because it was incredibly important, and if there's one thing that I hope anyone could take away from this entire podcast, it's being an advocate for your own health and potentially seeking out a second opinion. You speak with your doctor and you don't get any sort of thorough explanation as why you're either being put on birth control or why certain markers aren't being checked. There
Mm-hmm.
are fortunately clinics out there like Marek Health now who will, no questions asked. You want to look into any of these markers? Say less. We're going to check it. We'll actually probably encourage you to check more markers and create conversation around some things that have been happening in your life that maybe inspire you or encourage you to ask your provider some other questions. And so be an advocate for your health as much as possible. And yeah, I think it's awesome that you have done that. So, and many people don't because they just don't know any better, and you don't know what you don't know. And oftentimes you see your provider, you're like, oh, this is what my doctor said. I should be on birth control or whatever. And you kind of just
Mm-hmm.
take it at face value and stay there. But yeah, just wanted to point that out really quick. So hormonal replacement therapy and testosterone replacement therapy. As you mentioned, hormonal replacement therapy is more of an umbrella term. It does include other therapies such as estrogen replacement therapy, progesterone replacement therapy, corticosteroids. It could also include thyroid replacement therapy as well, in addition to testosterone replacement therapy. So it's a sort of, again, an umbrella term. If anyone is on birth control, that is a form of HRT. So yeah, and testosterone just being limited to testosterone replacement therapy utilized for putting somebody in normal physiologic ranges.
How does testosterone specifically impact a woman's health? Because again, you and I, we're educated, we're in this world, but there's a lot of people when I openly talk about it, men and women that jump on it and they're like, you don't need that. Your voice is going to change. You're going to grow a beard, all that. But we need testosterone, obviously. So could you just kind of give us an overview on that?
Yeah, absolutely. You also mentioned how like testosterone is pretty widely known as the male hormone, right? And maybe some people would be surprised by this, but females actually have way more testosterone in their body relative to estrogen and progesterone. So if you actually, I mean, anybody can do this if they have lab work at home that they're looking at. Testosterone is usually measured in nanograms per deciliter, and progesterone and estradiol are usually measured in picograms per milliliter. And so the difference between the two in the units is quite large. So if you were to actually draw a graph like relatively and look at, okay, where's my estradiol at? Where's my progesterone? Obviously, they fluctuate throughout the cycle unless you're on birth control. And you were to draw testosterone on that same graph, testosterone would be incredibly high. So it's really not like a male hormone. It's both a female hormone as well, and just as important, just as prominent. So it's incredible and important for a lot of different things, not just cognitive function. It's for just overall, like if you think about overall quality of life, we think about the ability to promote promote anabolism. It's for the ability to improve your overall mood and not just like being sharp, being clear and having this sort of clarity overall. It's important for bone density overall too. When you think of performance in the gym, when you think of libido, which is a huge one, and which is really the clinical reason why it is known, according to like NAMS or the North American Menopause Society, for testosterone to be used. It's really for hypoactive sexual desire disorder, but we can dive into that more. But it's so many different things that testosterone is important for, and absolutely necessary just to improve the quality of life. And you also did mention, like, how does Marek sort of look at these things overall? We start, again, as I mentioned, by having a conversation with somebody instead of just, hey, we're going to get this lab for you. It really does start with, who are you? Like, what's a day in the life like? Are you coming here to us because you're running into any sort of pain points or challenges that you can't seem to figure out on your own, or even by going to your primary care, you just don't seem to be quite getting there and finding a solution? Are you here just looking for overall sort of optimization, where you don't really recognize any sort of pain points at all? And what we'll do is we'll go through and I would say 99% of the time, we have labs that are going to be way more comprehensive and thorough than anything you've ever had before. And when we figure out what lab is appropriate for you, then we'll actually walk you through each of those markers, help you understand why the markers are the way that they are relative to how you're feeling or what was going on at that moment in time in your life, or other hormones or medications, over the counter items that you're taking. And just, it's like painting a picture and creating this sort of vision as to, this is what's going on, to kind of make sense, because it can be confusing looking at all these like different numbers and units and trying to understand what's going on. It's like a different language, but it's to, I would say, a lot of the times almost validate why people or other women are feeling that the way that they're feeling. It's majority of the time we can see what's going on in the labs, and we take that information and then help create a pathway to feeling better or find a solution.
And you talked about pain points. And even before we look at blood work and gather that data, a lot of times, me being a coach too, so many women complain about, brain fog, low libido. And one I hear so often that is a huge red flag to me is someone 20, in their 20s or 30s, and they have not had a period for X number of months or sometimes even years. And that to me is something I jump on immediately. That is always one of my goals as a coach, is like, all right, we need to get your period back. That is something natural. That is supposed to happen. It's a sign of health. So what are some common, let's say someone, does have a period, but their body's changing. And I think this isn't a fact, but I think because of birth control, or the generation, if you were born like 85 or after, that's when they kind of just put everybody on birth control. I think we're experiencing more like early menopause and more hormonal issues because of that. That's just what I'm going to go ahead and take a guess at. So what are some pain points that you commonly see? Because a lot of people, myself included, not want to even get that test because they might not want to admit they have a problem, because it can be scary to even think about, especially if you're young, healthy, maybe want to start a family.
It's really scary, I think, and this is why that conversation is important. And whether it's just kind of validating, like, hey, like, I know we understand how this can be scary to look at. It's like a report card, what's going on, but in terms of cycle, it's like a pulse on female health. and figuring out, well, do you have cycles? Have you had a history of normal or irregular cycles? How long have you been on birth control? What type of birth control have you been on? There's multiple different types. And so several reasons that could be, especially I'd say in this sort of arena when it comes to performance endeavors, not even necessarily performance enhancing endeavors. This is for somebody that could be natural. You can run into what's called like relative energy deficiency syndrome, or in just we used to be called as relative energy deficiency in sport. And then there's hypothalamic amenorrhea. And so essentially what it is it's a deprivation of the amount of energy that's coming in relative to the amount of energy or exertion that's kind of going out. And so it's just an overall imbalance in putting a woman in a position where the body recognizes I'm not in a good environment to be fertile and have a child. So that is an immediate sort of, all right, well, not in a good area for fertilization or to have a child, I'm going to stop my cycle overall. And that's just one. It could be obviously birth control. It's going to suppress those sort of LH and FSH levels, the gonadotropins, and just provide, or eliminate that ability for conception. So it's the contraceptive. Their timing is so important when it comes to understanding, well, if we're going to get these labs, are you on birth control, or like, are you planning to come off? And how long have you been off for? And then, was birth control used as sort of a Band-Aid, like you had mentioned earlier? There are so many occasions where I have women come in, they've been on birth control for years. Just had a case the other day where this lady said her doctor said she needed to stay on birth control. Not only that, she's on the pill. Her doctor said that she doesn't need to take her sort of green pill that she has to have a bleed. By the way, a pill bleed is not the same as a natural bleed. It's just a withdrawal from the hormones that you're on. So when you do that, you do increase the risk or the rate of like potential spotting. But it's understanding all of this, and it's incredibly important to figuring out what is going on, what's the overall health status at a baseline without any sort of hormonal influence at all. Because we also dealing with PCOS, what's going on genetically, endometriosis, anything like that. There's like so much to dive in and uncover. And this is ultimately why that conversation is important. Instead of just, oh, you want to get some labs? Sure, let's just go get some labs at any point in time. And the conversation is important. And all of that is without, or should be held in addition to, understanding where she is to begin with, right? Like, how does she actually feel about this? What are her plans? Does she aim to have children in the future? Is she scared or is she nervous? Does she have any sort of gut dysfunction going on as well that's influencing how she feels, creating more stress, influencing the cycle overall, creating more inflammation in the body? So as you can see, it's kind of like there's so much here to be discussed and understood prior to getting the labs, and then working through that in phases.
There is so much, and I just wanted to share a personal story because I think women kind of do have it harder in some ways on that front. So I was really young. I got my period fourth grade, and I remember going to my first OBGYN appointment, and I was expressing, bad periods, all of that. And my OBGYN specifically said, because I was an athlete, that I should be on birth control. So that way I can predict when I'm going to get my period. My cramps wouldn't be as intense. And I was on birth control from sixth grade all the way up until I was 23 years old. So that's a long time. And I know many women that have experienced, the same thing. It's like, just go on. But so just wanted to share that, and I'll get into testosterone levels. And, perhaps that could be why my levels were so low, because I was taking progesterone from such a young age for so long. It's not, like you said, there's a whole realm of different things to look at. But something that can be a little confusing is looking at ranges. So let's say someone goes to Marek, gets all their blood work for the first time, they look at testosterone levels. Now, I feel you have to look at it from a couple different points, throughout maybe 2 or 3 times a year, because they always have that scale where it's an optimal range. So I wanted to talk about that optimal range and then have you kind of describe how you need to figure out what your own range is. Like, where do you feel good? Because again, we're women, so there's a range, but we don't know and you don't know where someone is going to feel their best.
Right, exactly. So we do have ranges that I would consider more functional and optimal ranges. We also have to understand that when you go to a Quest or you go to a LabCorp, they're going to have their own typical ranges that they go off of. Now, we have to understand that those are based on averages. If you take like a bell curve, right, out of the entire population of the US and you just grab the average person, you have to imagine you're not necessarily going to be picking up this healthy, let's say 25 to 30-year-old female who's active, has no sort of metabolic issues, and just this healthy athlete. Same on the male side. So those ranges aren't necessarily ranges that we always want to go off of. We want to aim higher. We want to aim for more sort of optimal. And the range is not necessarily something, it's to be used as a goalpost. You really want to assess and see how somebody is feeling. You never, said in medicine all the time, you're not treating the number, you're treating the patient, right? And how they feel. Two women can have the same amount of testosterone value on paper, nanograms per deciliter. That doesn't mean that they're going to have symptom relief from any sort of androgen insufficiency at all, meaning not enough testosterone relative for their body or their needs. So the range is used as a goalpost. But if we were to say, hey, here's a typical range that we generally find people to feel good in, I would say the bottom end of that range would be around 30 nanograms per deciliter. I'd say an average range that maybe I personally like to see women in, just with the amount of lab work and women that I work with, probably around a 60 to an 80. Now, I have women who are sitting around the 130, 150 mark with no side effects or no symptoms at all, and they feel amazing there. And this is why the ranges are used as they are incredibly, incredibly dependent on the individual, and you can't necessarily apply one range from one person to another. And making sure you get lab work at multiple different points throughout the year, but also throughout the time period in which they may be doing certain things or certain activities or using certain compounds, right? And so are they, again, as I mentioned, were they on birth control, where all of their hormones are going to be suppressed, right? You mentioned you were an athlete. I mean, testosterone is incredibly important for energy metabolism. Your performance will certainly be skewed on birth control. Coming off birth control, have you regained your cycle back? If you have, cool. Let's test and see where your baseline values are at if your cycles are normal. Are you adding anything else in the mix at all? So multiple time points throughout the year, and that could be higher or lower based on the individual themselves. But I'd say, maybe on average, at least once every 6 months. But if there are other sort of physical endeavors that you're pursuing, then we would certainly want to do them more often.
Okay, so let's talk about some pros and cons, and I'm happy to share, some of my own results. So, a woman comes in having some hormone issues, you suspect maybe lower testosterone. They start with the dose that you recommend. How long until they experience results? And can we talk about what that might feel like?
Yeah,
How are you
yeah, of
supposed
course.
to? Just because I want for the person listening to be able to track their own data, because like you said, you
Mm-hmm.
can have someone guide you, but you need to be an advocate for your own health. I don't care if you have a coach, I don't care if you go to clinics, you still need to be able to track it yourself. So, what are some things that someone can take notes on right now?
Yeah, absolutely. So I would say if somebody comes in and they are deficient in or they have suboptimal sort of testosterone values, even though their doctor may have said that they're okay based on the Western medical ranges that they're in, they may feel just a lack of energy, drive, motivation overall. They may feel weak. They may not have great performance in the gym, again, have some brain fog and not feel like, and they may have like mood swings or anxiety or depression. Now, of course, these things may also be related to other hormones outside of testosterone as well, too. But these are things and key things to kind of just think about subjectively without looking on paper. So let's say somebody comes in and they start their testosterone dose based on what their medical provider felt was appropriate for them. We have to understand that there's going to be both genomic and non-genomic effects. And this is things that are happening at like the DNA level, which take time to actually manifest and kind of reveal themselves sort of symptom wise. And then there's like non-genomic effects, which you can probably tell within a shorter range of time. Now, I would say, generally speaking, you'll feel these results in about 6 to 8 weeks, but ultimately, like anywhere between the 8 to 12 week mark is when you'd probably reach this full sort of saturation period of, okay, like I really understand the differences in how I'm feeling. And most often this comes with, wow, like I feel good. Like I actually have energy. I'll even, get on some calls where I have both a couple there and, the partner is like, wow, I can't keep up with her. This is a lot to keep up with, like libido
Yeah.
wise, energy wise, which can be positive or negative, however you look at it. But it's more so like an energy, drive, vigor, just to like the ability to kind of attack the day, I would say, really changes overall, which then, as you can imagine, can boost confidence with how one feels. So I would say, if that answers your question about, somewhere between the 8 to 12 week or 10 to 12 week mark is when you'd really get that sort of full effect.
I'm so glad you said that too, because a lot of times, especially if people aren't athletes, if they're more lifestyle, they'll try this, and they're too quick to stop treatment without giving that full 8 to 12 week time period. Because I think just with the way the world was, everyone wants instant gratification. Someone will, start their testosterone therapy, and after 2 weeks, they don't notice anything or they can't feel any different. So they'll just
Mm-hmm.
stop it. So again, very important to give it that full 8 to 12.
One thing I would say there too is it also, if you do have a clinic that, isn't like overzealous or doesn't jump to high dosages, which hopefully they don't, you want to get the most from the least. So it's not uncommon to start a testosterone replacement therapy. And let's say after a few weeks, you feel like a minimal change, but nothing is really that significant. Well, that's again when you would want to do some follow up labs, see where your values are at, assess subjectively how you're feeling, and then potentially increase the dose until you find this range, both on paper, but mostly how you feel, where you feel symptom relief overall. And you also have to understand that there's multiple different methods of TRT. It's not just an injection. Some people have an aversion to needles and they're like, no way.
Mm-hmm.
I'm not going to inject myself at all. There are creams, there are pills that can be inserted as well. I don't really recommend those, but creams are usually another alternative where people almost feel like it's just not only less scary, but less serious or less invasive. So that needs to be considered too, because if you use a cream, you do have to allow it to dry and you do have to put it in an
Mm-hmm.
area that doesn't really have calloused skin or anything like that. So that has to be considered too. So the application matters as well.
Yeah, and just to touch base on the cream, I've never used it, but Chrissy's on it and she did her labs and had great results. And then I had a client actually who went to Marek and she was 41 years old. Was like, okay, I'm finally gonna jump on the TRT. I've been thinking about it. I have all the symptoms. I want to give it a try. She's like, do you think the cream really works? I said, yes, because she again was just opposed to needles, which I completely understand, very common. She actually was able to change. She actually ended up getting pregnant about 9 months into treatment, which she thought never could have happened. So again,
Mm-hmm.
it was an unexpected blessing, I guess we could say, but it just goes to show you that she was someone that, she was told, you hit early menopause, don't worry about it, you're never going to get pregnant, and look what happened from treatment. So it definitely works. And that kind of brings me to, you kind of already went over the pros and cons of the cream. Do you see at Merrick what is more common, the injection or cream? Or is it kind of half and half, would you say?
I would actually say it's more biased to a higher percentage of the injection than the cream.
Okay.
Generally, because I would say it sounds like it's more convenient in the beginning, which certainly a cream versus injections would be, but it's the time, and it's putting it on, could be twice daily versus an injection, which is twice weekly. And then it's getting ready, you hop out of the shower, you put it on, then you're like, all right, well, now I have to wait several minutes for this to dry and then go ahead and get dressed. And it becomes like a time thing as well. I think another thing that people are also genuinely concerned about is transference. When you put on a cream and you touch somebody else or somebody touches you, there's certainly a transference sort of issue that could potentially happen. So avoiding that with an injection is obviously easily done. So I do think people generally move more toward the injections, at least in my experience with the amount of people that I've seen here.
Choosing just because of bioavailability. And I'll
Mm-hmm.
never forget, I did my very first injection on New Year's Eve of 2023. So, a year and 2 months ago, I was so scared. I remember I had watched so many videos for how to do it, had people talk me through it. My partner was with me, and then I had him do the first one just because I was so nervous. And then after that first one, it wasn't a big deal. I was using a little tiny insulin needle, such a small dose, could barely feel it, nothing. So I understand how frightening that can be, that first injection. But
Mm-hmm.
then once I started to feel better and get results, it was worth it to me. So, I tell people, look at the pros and cons for both. And that leads me to, can we talk about the different types of testosterone and what Marek usually provides? So I actually brought mine with me just to have an example. So I don't know if
Mm-hmm.
you want to talk about what Marek has and what you recommend for women.
Yeah. So, well, mostly it will be there's different. There's going to be different concentrations, really, and this is ultimately going to come down to what dose we feel is appropriate for the individual, and maybe that's kind of more important to touch on. But for
Okay.
the most part, if we just kind of keep it simple, it's really different concentrations of either a cream or or an oil base that you would inject. There are different concentrations of the, like I said, of both, but for the most part, what we're still aiming for between those is a sort of a saturation point where the female feels symptom relief, right? So I believe you have your testosterone with you, and we kind of figured out what the dose was, right?
Yes. And again, I'm going to read it aloud because there are so many different numbers that it can
Mm-hmm.
be. That's why it's important to work with a professional that's going to help you, because I think
Mm-hmm.
I was so foreign to this when I was first learning about it. I was like, okay, can you just tell me exactly what my injection is going to be? So what my bottle that's prescribed to me says: inject zero point 0.4 milliliters, 40 units subcutaneously every week. Testosterone cypionate. The concentration is 25
Mm-hmm.
milligrams per milliliter injection, 5 milliliters. So I inject 6.25 milligrams per week.
Correct.
I like to personally break that, just from what I've learned, break that into two doses. So I'll
Mm-hmm.
do a Tuesday and a Friday. And again, we can talk about that too. I think it's whatever someone's going to remember. I just like to have not the high concentrate and then low. I personally feel better when I just break it in two. But that dose, a little confusing. Can we talk about what that
Yeah,
means?
yeah, it certainly can be confusing. And this is why it's incredibly important to speak with your, medical provider or one of the health coaches at Merrick to help break that down and honestly give you a visual representation of what does that actually look like on the syringe when I'm drawing to it. Because I'll have people in a call, I'm like, I look at their numbers on paper and I'm like, that seems a little odd. Can you show me
Mhm.
what you're drawing to? And I swear, people will literally give me the hand. I'm like drawing about this much,
Not something
and
you
it's
should
it's
guess with.
no, not something we should guess at. There's a really cool calculator that I'll share with you, and maybe you could put it in the show notes to help people understand if
Absolutely.
this is the dose that I'm at, and this is how many times I'm taking it, how many like units should I be drawing to in the syringe? So it's really clear. It'll do the math for you. But what's incredibly important here, probably the most, is looking at the concentration of the vial that you're using. So for men, typically the concentration on the vial is going to be 200 milligrams per milliliter. For women, it can be or should be a lower concentration, around 25 milligrams per milliliter. That means for on a 100 unit syringe or a 1 milliliter or 1 cc, if you were to fill that to the top, it would be 25 milligrams total. For the male version, it would be, if you filled it all the way to the top, you'd be getting 200 milligrams. It's not uncommon, and sadly in this space, for girls who are potentially interested in using some performance enhancing substances at all to utilize their husbands or boyfriends' testosterone. They pass along their highly concentrated testosterone to their wife or girlfriend or client or whoever, and they take what they think is a little amount, but because the concentration is so high, it skyrockets their testosterone and also opens the door for more unwanted side effects, some that cannot be walked back from.
So and that is a very common scenario. Someone wants to experiment with it instead of getting, hopefully it's pharma grade, that's what you want to do, but who knows where it could be from. And that concentration is so
Right.
important because, again, if you're injecting it, looking on even an insulin needle, even the smallest amount from your partners, it's going to just the skew. So I'll share the calculator with you, but let's talk about some of the potential cons that could happen if someone does go over a recommended amount that isn't good for them, the reversible ones and irreversible.
Yeah, absolutely. So I think we should first also just say that, like, even though, because we kind of touched on how talking about testosterone is like people are talking about it now, maybe the last couple of years, it's hit maybe what we see as a peak and probably more so from social media. But testosterone therapy in women has been used for well over 6 decades. So it's not anything new, it may be new kind of for us to talk about, especially in this space, but it's been around for a long time. Now, the most common side effects that women run into when it comes to testosterone therapy are going to be hirsutism and acne. So that would be like hair growth that men usually present with. So that could be on the stomach, that could be on the back, and it could be facial hair. And then, acne. Those are going to be the most common, which are manageable either through adjusting or altering the dose, whether that's the dose or the frequency. One side note there too is if other compounds are being used in combination with testosterone, which popularly are used in bodybuilding or sport performance, enhanced performance, whether it's powerlifting or strongman, bodybuilding, anything like that, or maybe even just casually, the dose and the duration is going to be really what people need to look out for. So outside of like hair growth and acne, you can look for that sort of hair growth on like the chin. It can be potentially receding hairline. And there's also clitoromegaly. There's also voice changes that can happen as well too. And unfortunately, voice changes are one of those side effects that you can't be walked back from. The testosterone not only lengthens, it thickens the vocal cords. It's usually, what happens through puberty um, in young men, and through the use of testosterone, especially if the dose is too high or they go supra physiological levels, those sorts of things will and can happen. But this is supra physiological levels or doses that are inappropriate when the levels are administered at a normal physiologic level within a range that someone feels good at. There's really little to no side effects at all. And this includes, and I could send you references here, there's plenty of studies on this. It includes cardiovascular risk. There's fears of breast cancer risk, which are actually reduced with testosterone. Any sort of vascular disease is actually reduced. I would say that what's interesting is I think some of the side effects, like the main ones, people are like, if I take testosterone, I'm going to, look like a man. And that is not always the case unless their dose is again in supraphysiologic levels, and there's no necessarily increased risk. There's also really cool studies on female to male individuals who do not have any increased risk at all in sort of coronary artery disease or any sort of increased mortality rate at all, which I find kind of fascinating and interesting, because people think, oh, if I take too much, like I'm going to be at risk. And there's no risk for that population. And we're seeing now more than ever more studies being published on that population. I have some trans clients, and it's another thing I think people think about too is, if I take testosterone, I don't want to be big and bulky, and I wish it worked like that,
I wish.
but
I know.
it doesn't work like that. So
No, it definitely doesn't work like
yeah,
that. Could you
yeah, but
send
there's
me? I
those,
want to post
yeah.
some. I was just going to ask if you could send me the study, because that's exactly what I was going to ask next. Kind of, do we have enough data to support TRT in women? And like you said, this
Mm-hmm.
has been something we've been using for 6 decades. It just wasn't talked about out in the open until recently. So I'll post
It's
those.
really what it is symptom relief. And that is shouldn't be narrowed down to just testosterone, although we'll keep it to just testosterone here. But that symptom relief does include other hormonal replacement treatment overall, right? Whether that's estradiol or whether that's progesterone or thyroid. But again, testosterone is really kind of clinically used, sadly, only for hypoactive sexual desire disorder or female sexual arousal disorder. When it comes
Mm-hmm.
to the use of testosterone now, it's considered off label, but there's so many positives to it, with just enhancing and increasing the quality of life once you find an appropriate dose, of course, that is recommended and administered by or prescribed from your medical professional. There's so many positives to it that there's just no super long-term data or clinical trials on the testosterone in that way.
Mm-hmm. So, yeah, and that can be something I think the individual just has to make that choice if they want to go on it. And what I wanted to kind of talk about last is if you have a more holistic approach. So, I was someone that I thought I just didn't want to have to take anything. So, I said, okay, I was working with Merrick. I was like, before I start this, let me see if I can do it naturally. My levels, so I had gotten blood work 2 or 3 times a year, and I remember looking back when I felt healthy, I was in that 50, 60 range. For the past several years, so I did a bodybuilding show, and then I moved cross country, and then I was in a really stressful life event, and it seemed that no matter what I did, I could not get my testosterone up. So it was at a 7 at one point. And so what I did was I started addressing other things, mineral deficiencies. So I was trying to, my gut health was in check, stress levels were good. I was going to bed at the same time every night. Like I had to live my life. It was about 8 months where I was so obsessed with trying to get better naturally. I was eating anything that was full of selenium. I was eating like liver. It wasn't fun. And then I was thinking like, okay, can't wait to go get my blood labs, see if they improved. And they got to a 12. So I jumped from a
Mm-hmm.
7 to a 12. So I was like, okay, all that work for 6 months, and I still feel like this. So my symptoms were just really tired, irritable. Some of my hair was thinning and falling out. And I just, at this point, I had been a natural athlete for 5 years. I hadn't done anything. So that's when I decided to make the switch. So for me, it really was life changing because I was able to compete again because I didn't think it was something I ever would be able to. So I just wanted
Mm-hmm.
to share that story because I was, again, and I'm sure a lot of people are like this, I just didn't want to have to take anything. I was scared. Is this something I'm going to have to take for life? So if you want to just touch on that, because that was something that I was like, I don't want to have to commit to this for life. At the time I was a single woman. I was worried about the expense of it and all of that. But again, the positives definitely outweighed any of the negatives. So,
Yeah. I think when it comes down to it, the second thing, as I mentioned, first being an advocate for your own health. The second thing, and something that we all strive for here, and myself as a coach, is helping somebody make more informed decisions. And it's really weighing out the pros and the cons, and not just narrowing that to a short-term goal, right? There oftentimes it gets a little clouded. Hey, I really want to do this show. I really want to compete here. What can testosterone do for me? And you kind of almost like narrow down your scope of what do you think it's going to do for you, or can do for you. But it's really understanding sort of the long-term effects and weighing that out, not just physically what it can do for you, but it mentally, how do you feel about it? And this is even maybe what some consider like, just simple or like less complicated sort of situations. For some, it's having a conversation about it when somebody finds testosterone in your bathroom or sees some syringes in there. What sort of conversation is that going to spark between you and a potential partner or a family member or kids, something like that? Like there's so much more to it that you just have to kind of bring into the conversation, like, hey, like, where are you at with this? How does this sit with you? Here's what it could do. Here's some potential risks. So ultimately it's informed decision making. So this is kind of that holistic approach, in addition to, like you mentioned, all of the lifestyle factors. Like, you can't just throw hormones at somebody and expect it to be a panacea. Like, testosterone is not a panacea
Mm-hmm.
at all. So it's really diving into, what is your sleep like a day in the life? Like, what does your diet look like? What has your diet history been like? What a sort of family history like? Are you at risk for any sort of autoimmune, any sort of hyperlipidemia, anything like this? Digestion at all? What's your energy like throughout the day? What are your stress levels at? Like, what do you do for work? And managing all of those variables and trying to kind of optimize within that. Again, making sure that you're not kind of overexerting yourself and falling into this overexertion, which can happen for women who are not on hormone replacement therapy, and they fall into this all of a sudden losing their cycle even naturally. So it's managing all the lifestyle stuff and then seeing what hormone replacement can do in conjunction with these lifestyle variables overall to influence the most positive impact and have a higher quality of life. It is not necessarily testosterone anyway. It's not necessarily something that has to be lifelong. But I will say, if you do start it, 9 times out of 10, women are like, wow, these benefits are so amazing. I think I'd rather choose to stay on it. If you do come off, it's same thing for male and female. Stopping cold turkey will create a whole host of hormone imbalances. It's like a symphony, right? If you have an entire symphony and all of a sudden somebody takes out like a big instrument, it's gonna sound funny. Things are gonna be thrown off. So you can't just like drop something off right away without consequences. So it doesn't have to be long term. Most of the time, women decide to stay on it long term, but there's ways through it either way.
Yes, that was the most, I'm so happy you addressed that. That was the most common question I was asked, is if I decide to stop treatment, is that even possible? Because I think a lot of people think once you start, you can't. But like you said, if you do want to try coming off, there's a way to do that so that you're not just stopping cold turkey. So that was
Mm-hmm.
important. What, and from you, I'm just curious because obviously I'm a woman, so women ask me questions. What would you say is the most common question when a woman is starting TRT that you're asked? Is there anything we haven't addressed? I would assume pros, cons, dosing, duration of treatment, all of that. Is there anything we didn't
Yeah, I, I
cover?
think I think the most common thing is, hey, like, what are the side effects? And that's mostly the androgenic. Like, hey, am I going to start presenting in a different way? And then also like breast cancer, cardiovascular disease, cardiovascular risk, things like that. I think one of the cool things about the ability to get lab work done is it's beyond just serum labs. There's also what we offer and what's called a Dutch test, which is super cool. Not necessary for everyone, but a Dutch test does allow you to see how you could potentially present by looking at the androgenic sort of pathway somebody genetically has. So through a Dutch test, you can look at different metabolites of DHEA and testosterone. You can look at what's called like androsterone and etiocalanolone, and there's two different pathways. There's like a 5 alpha pathway and a 5 beta pathway. Not to get like too into it, but really, if
No,
if
I
you
love
are
this. I think this
stressed
is
out,
really
if
important.
Yeah. If you're more stressed out, if you're more insulin resistant, if you have more inflammation, you will drive more towards a 5 alpha pathway, which will create more of a androgenic sort of side effect. Some women, and this is why I said some women can take 2 doses, the same dose, but one woman presents with some androgenic side effects while one woman doesn't. And you can kind of see this through the pathway which someone takes by looking at a Dutch test and see, wow, like I can actually have a higher amount of testosterone and not present, have these androgenic side effects while some do. And, you can see this even in women who have PCOS. There's hyperandrogenism, which usually is one of the key characteristics with PCOS. And you can see some of the 5 alpha pathway being expressed a little bit more than a 5 beta pathway. I mean, really the only way to see this is looking at a Dutch test. But other than that, you really just look at the symptoms and how they're feeling and how they're presenting. You don't need to see it on paper to actually notice these things happening, but it is super cool. And point is that there's more than just serum tests to do when you're really trying to look at this stuff and, hey, how susceptible am I to such presentation overall?
No, great points. And I actually personally haven't taken a Dutch test. It's something I've always wanted to do. So I definitely want to do that because I'm more of the type, which isn't good. I think it's better to dive into the details. I kind of just look at the symptoms and then my regular levels, and then I self monitor. But Dutch test is definitely, I'm really excited because you told me about that. And I suspect kind of what I am just based off what I've done. But again, very, very important to do that. Now, I think another question I get from clients is, and I know Marek helps with this, as women, our bodies are a little bit more complicated. The best time to undergo labs, because we have different points in our cycle where hormones are going to shift naturally. How does Marek work with that? Because
Yeah, great
obviously
question. So
someone can't
first,
always, yeah.
right. Yeah. So first, it's understanding when and if, do they have regular cycles? Are they on birth control or not? Let's say someone has a 28-day cycle and everything is regular and normal. We would have them get their labs drawn between days 19 to 22, or about 5 to 7 days prior to their cycle starting again. What we're looking for is to see if they've had a healthy sort of ovulatory cycle. So you have your follicular phase. If you break it up into 3 sections, you kind of have your follicular phase, and then you have ovulation in the middle, and followed by the luteal phase, throughout which you do have different concentrations of estradiol, progesterone. You see fluctuations in your gonadotropins, LH and FSH throughout all of this too. And including testosterone. So we like to see where these values lie around the mid-luteal cycle or mid-luteal phase, just to get an understanding as to, where you're at. Now, ideally, somebody has, normal cycles to see this, and then we address thereafter. We may potentially need, or we will likely potentially need more labs to kind of confirm where their levels are at. And it can be kind of quite complicated, right? We aim to get them done at a certain time, but shoot, maybe your cycle started a couple days early. Maybe you missed the window and you really need to get them done at a certain time because work is crazy. You got the kids and a bunch of stuff going on. So this is where the context matters completely. We want to know what are your cycles are like generally prior to getting them done. And if we could time it appropriately, then it would make the most sense, which Dutch has a really cool cycle mapping test to show you what your hormones are doing throughout the month too. Not that I'm just trying to plug Dutch here, but it's really cool to see. And ideally, under normal circumstances, it's around day 19 to 22.
And we keep talking about being an advocate for your own health. And that is one of the first things I recommend anyone do is track your period. Just put down, I don't care if you don't know anything about the different cycles. Put when you get it, the duration of it, and when it ended. Do that for a couple months. That way we can determine if you even have a normal cycle. And if you don't have a normal cycle, again, I think that is your first red flag that something is wrong. If you're a young woman, you want a period, sign of health. So I know we could have like a 2-hour episode, but I want to be mindful of your time. So I kind of just want to switch it up a little bit. And
Sure.
I have a kind of a random question, just get to know you. I know you have a dog, Coco, And I was
I
reading your
do.
bio on Marek Health. If you could only eat one sushi roll for the rest of your life, what would you choose? I just have to
Oh
throw out
God,
something
that's
fun.
tough.
We've been so
That's
serious this
tough.
whole podcast.
Yeah, for sure. My wife and I were talking about this the other day. I have to like pick like one place here because there Azuki Sushi in San Diego. Shout out to that place. If anybody lives in San Diego, please check out Azuki. They have this lobster roll that is like to die for. It's probably the best roll I've ever had. I would certainly go for that one for sure.
Okay, I'll check out that place. You have to try if you haven't already.
Mhm.
You and your wife need to try. It's sushi
It's
here in
sushi.
Vegas.
All right, we'll try it.
Yes, it's on.
We'll try it.
I feel like they love big people. Like if they see you come in and you look big, they have the fastest service, and then they have certain times. Kind of late, so I haven't been where it's like half off, so you can get all you can eat for like
Oh, nice.
$15 or something. It's crazy. So you definitely
I'm
got to check that
sold.
out.
I'm sold.
But where can people? Are you actively taking more clients right now?
I am, yeah. So if you go, you can go to merrickhealth.com and you can find me under the coaches there. If you just select work with me, you'll have the capacity to fill out one of our client forms there, health history questionnaire, and then you'll be directed to my calendar. You can also find me at setthestandardfitness.com as well too.
Okay, perfect. I'll put those links in there. And any final thoughts or takeaways you want to leave this episode with? Again, I know we went into a lot, but we didn't dive really, really deep into anything because I wanted to be, I wanted to keep this to an hour.
Yeah, I would just say, again, like, thank you so much for the time. I think this topic is incredible. And, as we mentioned, if there's one thing, please be an advocate for your own health. There are a ton of amazing resources out there. So, again, if you have questions, you could seek us out at Merrick Health too. But I would say, question everything and make sure you make informed decisions, whether that's from your coach that you're being coached by privately or even your primary care. Get different opinions for sure.
Thank you so much, Mike.
Thank you so much, Brittany.